We are going to be talking now with Mr. Ramfish. He is the Chief Executive Officer of 19 Labs. And 19 Labs basically has been contracted by the Ministry of Health to promote telemedicine in remote and rural areas of Guyana. Mr. Fish, good morning. How are you doing today?
Good morning. Delighted to be here.
All right. We are glad to have you. And we are going to be joining Miss Davina Ayah. She is one of the community health leaders there in the village of Guns in region number 9, which the program has been very beneficial to as well. She'll be joining us virtually in just a moment. Mr. Fish, could you tell us, 19 Labs, what's your mandate?
Our mandate is to solve rural healthcare. We work with government to bring all these amazing technologies that can help provide good healthcare, train people like Davina, train the doctors, and enable the delivery of advanced, sophisticated healthcare, effective healthcare in the most remote places on the world.
Yeah, you mentioned telemedicine, transforming telemedicine in rural areas, remote rural areas of Guyana. I know recently you went to Guns Village and you went to other remote areas of our country. Could you tell us about the impact of that program in these various communities?
Absolutely. The initiative started about 8 months ago under the leadership of the Health Minister, Dr. Frank Anthony. And the vision that he has is very much aligned with what we believe in, that we can bring some of the most advanced technology in healthcare into those remote communities, things like EKG, ultrasound, exams, camera. And we use the existing healthcare system, the doctors in Latham, the doctors in GPHC, to now provide care in those communities to people that otherwise will not be able to access care. And being able to do this has been groundbreaking and an amazing story of a successful government-private-public partnership that in record time, this program has already been operating for about 3 months, have saved multiple lives. I think by now we've had 3 medical evacuations done out of Guns, multiple serious cases of patients detected early, and really been able to have an impact on healthcare and deliver healthcare equity into those communities.
Wow, fantastic. As a result of your intervention, 19 Labs intervention to train and to equip the medical persons in these areas, what was the response like to the training? How you feel it was impacting in these various communities?
The training is an amazing story of how you're able to use connectivity to bring some knowledge and education into the most remote places in the world. People don't believe me, but you see here Davina, she got the training done on the web from her community using a fast broadband internet connection. Once communities get connected, this is not just about healthcare. You can get the most advanced classes and seminars from Stanford, from Yale, sitting in your YY village in a remote hut. The educational opportunities that are being opened through broadband connectivity are just an amazing, and I'm proud to be able to leverage them to open the door to those opportunities.
Awesome. How many persons altogether were able to benefit from your training?
The training today, we trained about 20 doctors, about 10 community workers. We are now expanding this to more sites, 15 more sites in Guyana in the next quarter. Hopefully we'll get more afterwards. But this has been a very successful trial, I think, for the last 4 months, and looking forward to bringing this healthcare services. And, it's really not us. It's the amazing work in here, and I worked with governments in multiple places, is the leadership that the government have provided here, from Dr. Leslie Ramsamy to the Health Minister, Dr. Frank Anthony, to the Permanent Secretary and everybody below, getting behind a groundbreaking program that's very hard to do with a lot of moving pieces. Satellite connectivity, lots of most advanced technology, conference room in GPHC, and bringing it all together on record time to be able to see what you see today with Davina has been pretty amazing.
All right, and with that said, we want to say a very good Thursday morning to Davina Ayash. She is one of the community health leaders in the community of Guns in Region Number 9. Davina, very good morning. How are you doing today?
Hi, good morning.
All right, how are you doing today?
I think she's very nervous.
I'm fine, thank you.
All right, good. Well, you're live on NCN Morning Show Guyana today. We want you to share with our viewers how you were able to benefit from the training offered by Mr. Fish and the team.
Okay. Since the telemedicine was introduced, I wasn't acquainted with the use of the devices, but with the help of Mr. Ramfish and his colleague, I was able to gain knowledge.
Okay.
So far,
Sorry, go ahead.
we had 3 medical evacuation. One of the medical evacuation was the 3-month-old baby. After we had telemedicine session with the doctor in Latham and Georgetown, they assessed the baby had internal infection, so was advised for the baby to be evacuated. Later, the baby was diagnosed with meningitis, so we were able to save baby life.
Wow, beautiful. Prior to 19 labs coming into your community, what was the operation like as a community health leader at your center?
The people were extremely happy because they can now speak directly about their complaints.
Okay, and moving forward, how do you see the community benefiting from the intervention of 19 labs?
Since the telemedicine, I now have access to Georgetown and Latham, and the specialists at this hospital help me to manage patients.
Mm-hmm. Yes, certainly. Technology has done it, and we are so happy that from that remote area there in Guns, you can, communicate and receive medical advice either from Georgetown Hospital, from Latham Hospital, and so we continue to wish you all the best as you move forward with your operations there as the community health leader. Anything else you want to share with us in terms of the program that you've received, the training that you've received?
I will tell you about Guns. Guns is the most remote area in Guyana, and we have the population of 331 persons. It takes days to get to the community unless you take a plane. Providing health services was very difficult, especially to complicated patients. Since the telemedicine, I now have access to Georgetown and Latham, and even the patients can now speak directly about their complaints.
All right. Davina, thank you so much for sharing with us today on Guyana Today. And we're very happy that 19 Labs was able to go into your community and provide telemedicine training and services so that now you now have access to the hospitals, and patients as well can speak directly to doctors in these various hospitals. We wish you all the best, Davina, and you have a wonderful day. Thank you for being with us.
Thank you too.
You are welcome. Wow, what a testimony there. What a testimony. What was it like working with Davina?
It's pretty amazing because it goes both ways. It's not just exposing, I think, a woman like Davina and training and empowering her. Me and my team and people around us have been exposed to the YY people.
Lovely.
We've been exposed to how they celebrate, to cultures. And I think this is one of the best use of technology,
Yes.
that you exchange knowledge both ways. And it's been an amazing experience working in Guyana, getting to know the remote villages, getting to know the people, and being able to bring back some technologies that help you provide better healthcare.
Yes, and in turn being able to save lives as well. In wrapping up, Mr. Fish, what's next for you? Where are you taking this project next to?
We hope to expand it within Guyana. We're actually launching with some of our partners service right now in Turkey and the Syria border. We have it in some other refugee camps. We have it in Mexico. There's huge opportunities to really change healthcare. The technologies that used to be packed, be in a hospital, super expensive, are changing. And that's the vision that we believe can change. You were asking me earlier, what is the name 19 Labs? The story behind it is 150 years ago, a woman called Florence Nightingale reinvented the delivery of healthcare. Technology let you do it again today. You have small stethoscope, ultrasound, EKGs, blood testing. And when I realized it, I was leading digital health at Samsung at the time. I said, we need to do what Florence Nightingale did before. So we named the product 19 GALE, and we named the company 19 Labs. And the vision is really reintroducing Florence Nightingale to the 21st century.
Awesome, fantastic. And we take this opportunity to thank you for collaborating with the Ministry of Health to transform health services in our country.
Delighted to do so.
All right, thank you so much for being with us on Guyana today.